It's time to get personal about the coronavirus. Hi, I'm Scott Ott, and this is Bill Whittle now. And Bill, normally in this show, I grill you with questions that come from the news, but it occurred to me that I rarely let you set the agenda as much as you try to take it from me. I'd like to do an episode where we just talk about your thinking currently and kind of give you a free hand to go where your mind has been going. And let me just ask first, on a personal level, with the whole pandemic going on around the world, you're not just a pundit, you're a person, and you have family. How are you doing? How are you holding up?
I'm glad I got a chance to answer that. I am and have been from the minute I did the first 20 minutes of research on this. First things first, I am not the slightest bit worried about my health personally. Not the slightest bit worried about the health of my wife. And of all the people I know, 3 of them have already recovered from it. And of all the people that are close to me, I have 3 that are risk now. And I'm concerned about those people. So, but in terms of my own personal attitude towards the disease, when I found out what the numbers were, when I found out how the fatalities broke down, when I found out all of this stuff. This information's about, I want to say it's about 5 days old now, but it was from Johns Hopkins University, which is unimpeachable. It's simply the most credible medical source, I think, in the world. And as of 5 days ago, I was reading this to one of my relatives who is somewhat at risk. And they said of the 45,000 cases that they had analyzed at the time in China, something like 82% of them were considered mild, which meant either no symptoms, mild symptoms, or some slight congestion in the lungs. So 82% out, and this is out of China with their smokers and all of the air pollution. And this is according to Johns Hopkins. They said of that 82% that was considered mild, the recovery rate was 100%. And then the next category was severe, which from memory, I want to say was either 12 or 14%, which meant labored breathing, advanced heart rate, respiratory distress. And in China, the recovery rate for severe was 100%. And at that point, I just went, wow. Then it got into people who were in critical care or advanced stage and so on. And then you started to see some mortality figures. So my first thought was that this is not going to be something that shuts down society. And the reason it's not going to shut down society, based on, when I say early numbers, I don't mean 10 cases, I mean 30, 40,000 cases in China. It was clear to me that the enormous majority, in fact, the overwhelming majority of these cases occurred not only with elderly people, but with elderly people who were in real distress before this thing came along. And when I saw those numbers, I began to realize that just for example, that food supplies, at least staples in America, don't seem to be in any danger of not showing up in the supermarket, because the people who farm the food are young and healthy and at apparently exceedingly low risk for this. The truck drivers that deliver it, the young people that stock the supermarkets at night. When you have the kind of epidemic that knocks a society out, it doesn't necessarily have to be due to a body count, but if you incapacitate the people that do the heavy lifting in society, you can really mess things up. And this virus is not affecting those people in any significant numbers. So that was my first intellectual thought. Since you asked, I'll just come out in a minute. My first emotional thought was, I want to go out and get infected right away. For a number of reasons. Mostly, as an example, I thought that there was no better way to show people what this thing does than to get it and then just do a series of 6-hour updates for the 2 or 3 days that I would be feeling low. And if I had to go to the hospital, I'd go to the hospital. And, and if by some fluke I didn't make it, then we all got to go sometime. But I really, this one had an almost overwhelming desire for me to run towards the sound of the gunfire or towards the sound of the antiseptic spray. It's Gunfire sounds a little better to me. But I wanted to get it. And the reason I wanted to get it was twofold. Number one, I wanted to show people that this was not the death sentence that they thought it would be. And secondly, once you've got it, at least for a reasonable period of time, you're immune. So those were my initial reactions. And those reactions have changed significantly in the intervening 7 or 8 days or so.
You're saying they have not changed
No, they have
significantly?
changed. They have changed.
They have changed.
Yeah.
So how has your thinking and your, frankly, the emotional side, because I think, Bill, the big challenge for folks on the right is a lot of times we can sound like a PowerPoint presentation that's been sterilized of all humanity. How has your emotional and intellectual response developed over the course of the past couple of weeks?
That's a great question too, Scott, because I agree with you. And once again, you and I had a personal discussion about this yesterday that did me a lot of good, that it's the inclination in these polarized age is to see the worst of the other side and just assume that they're either idiots or Satanists, one or the other. They're both idiots. No, never mind. But here's the thing. I think conservatives see people who are reacting hysterically to this, and there's no question that that word is appropriate in many cases, that there are people who are hysterical over this, fully healthy people in their 20s who are late 20s, early 30s, locking themselves in their houses with a month's supply of food, never leaving because they're sure that this plague is going to come. And it is the nature of conservatives to be considerably less emotional about these things, considerably more rational. And what I hear among many conservatives, and you can make a compelling case for this, is that the remedy is going to be worse than the disease, that the economic damage caused by all of this social isolation and so on is out of proportion to the threat. And that was my initial reaction. My secondary reaction was not to become hysterical, but was to look at it for a wider number. Even if we're talking about, so let's just take a look at mortality rates. If it's 1% in a nation of 300 million people, that's 3 million people. I think it's going to be considerably less than 1%. I really, really, really do. But even if it's 1/10 of 1%, and I think now we're getting optimistic at that point, you're still talking about 300,000 people. Now again, see, statistics are very, very, very misleading like that. That number would suggest that if you had the entire population of America infected, then you'd lose those numbers of people. But in any epidemic, like a flu epidemic, it's not everybody who gets the flu. There's clearly COVID-19, and these are some, since you asked me how I'm dealing and coping with things, it is a form of flu. It is a flu-like virus. Its transmission vector is essentially the same as the flu. It's much deadlier than the flu. So it's not just the flu, but it travels like the flu. And you have to ask yourself, I mean, I live in sunny California. I haven't had the flu since I was a kid. So when you do the math on these numbers and you look at mortality rates, you make the mistake that I just made a second ago. You take the entire population of the United States and multiply it times the mortality rate, when even if we had the mortality rate established, it wouldn't be the entire population of the United States. It would be the percentage of the United States that was infected. And my understanding is in a bad flu year, that might be 15% of the population total that's got the flu in completely. And then you take numbers out of that group. So look, even if you do all of this stuff, we're still talking about really, I don't see anything less than tens of thousands of people and perhaps hundreds of thousands of people, but certainly I think we'll see tens of thousands of people succumb to this disease. But the people who succumb to it apparently are the people who are in a pretty narrow, in fact, exceedingly narrow risk group. That would be people people who are elderly and who are already suffering from serious pre-existing medical conditions. So what I've come to realize is that I knew from the beginning when I heard that this was a flu virus, that this would not be contained. Once I heard that it had spread to hundreds of people in Wuhan and that people were coming back from Wuhan, I knew it could not be contained. But what I had not factored in was that it could be slowed, and significantly slowed. And what we're seeing now is something we've never seen before, ever. It's not like we haven't seen pandemics before, but we have never seen what happens when you throw all the circuit breakers at the onset of a disease. And that's exactly what's happened. And so I drive down the streets of Los Angeles at 8 o'clock at night, and it's like I'm like the Omega Man, it's like there's nobody on the road. Restaurants are closed, takeout is still available. Supermarkets are, to most extent, I think most of the panic buying is largely over, but the food gets delivered every night and restocked and so on. I know the economic hit is going to be tremendous in the short term, but we've never done this before. And as I kind of come into a sort of an appreciation of what's happening around the country and around the world, you have to start asking yourself some pointed questions. And that is, what economic price are we willing to pay to save a certain number of lives? That may sound cold, but that's the equation. And this argument, well, if it just saves one life, has never held any weight with me whatsoever.
I want to get to that, Bill, because what you just said and what you've just described over the last several minutes is a very rationalistic approach to establishing your emotional response.
Right.
You have a tendency to, I'm sure you feel that's sort of what they call the lizard brain reaction, where you immediately have a threat appears, you have a fight or flight instinct, but then you back up and go, okay, well, what's the real nature of this threat? And you reason your way through it and you do research and stuff like that. But one wonders if you can apply that same kind of metric to everybody. The tendency of people who think like you is to say to other people, think like me. Do it the way I'm doing it because it works for me and it would work for you, and it's better to not be upset than it is to be upset. However, the people who don't think like you are looking at just the opposite and going, oh my goodness, that cold, rational guy who's now calculating how many lives are we willing to sacrifice in order to miss so we don't miss a paycheck or we don't miss a mortgage payment. What kind of monster thinks like that? And it's not an ideology, really. It's kind of a psychological makeup. How do you deal with the differences in the way people think when you've got to make policy for a whole country, for example?
Let me deal with what kind of monster thinks like that. Let's just take this argument to the logical extreme. Is it worth a total collapse of the economy, a depression the likes of which we've never seen? The Great Depression was happened when most of the country were farmers. Is it worth, if every single person's job is lost, if the food supply breaks down for economic reasons rather than biological reasons, if nobody ever goes to work again or never gets a paycheck again, is that worth it to save the life of an 80-year-old person who has emphysema already in the hospital? If you want to take the argument to its logical conclusion, that's the argument. And I don't think that is the case. I think the harm generated from that is far greater, and it's greater in terms of lives and impact and so on. It's greater all across the board. I'm not one of these people that munches numbers. I don't consider people to be indistinguishable cogs. I'm an individualist. I think every single life is unique and precious. But in times like this, you have to think like an adult. And when you think like an adult, you have to realize that this is an equation. And by the way, for those people who thought that was a pretty monstrous thing for me to say, you could cut the number of highway deaths, including deaths of children that die in car accidents, to zero. And all you would have to do is never drive a car of any kind again, ever. Now, that would, without question, eliminate the number of people who are killed in car accidents in this country every year. Is that worth doing? Because if it's not, then you are now dealing with the exact same kind of equation that I'm talking about dealing with here. Everything that we do.
It's almost, Bill, like the part that sounds monstrous is really you're saying out loud a calculus that people do in their heads without even thinking about it. Even people who are primarily emotional.
Precisely correct. Which is why when I'm doing my best to check fear as much as possible. I'm doing it in the best way I know how, and with the most research possible, and the most self-examination, because this one's not a political opinion. This one is life and death. And I am trying to be a control rod in the fear. And what I mean by that is this. When I told the family member I have who's at really quite extreme high risk, I said to her, listen, I'm not telling you not to be afraid. I'm telling you to put your fear in a box the size of what you should be afraid of, right? You can't. What's happening in the culture now is that this fear has exploded out of the actual risk, and now everybody is convinced that it's just a matter of days till the bring out your dead cart comes down the street. That is not going to happen with COVID-19. That's not going to happen. It's just not. But if you do the math and you start saying, my God, if you lost 1% of the country's population, total population, or even 1/10%, you're talking about 300,000 people, 3 million people. Those lives are important. And so right now right now I think we're doing a pretty good job. We have not shut down everything. We've not confined people to their houses. I heard anecdotally, and now, you know what? I'm not going to repeat anything I've heard anecdotally.
Thank you. Appreciate that.
You're welcome. But right now, it seems like this is an aggressive but reasonable response to this pandemic, and the lives, and to the degree, here's what the social isolation is. Look, I live in a big city, and there are no cars on the streets. I go to the supermarkets, and there's nothing on the shelves. Everybody's panicked. Everybody's freaked. And that bothers me on some level simply because I have, over time, learned how to manage this risk-reward thing and pretty much go through life unafraid of pretty much anything, really, except for, carnies. Everybody's afraid of carnies. But the frustration I feel is that I'm frustrated that people are not more willing to look at what this thing is and decide what size of a box you want to put that fear into. And here's a great example, Scotty. For those of you who are old enough to remember 9/11, I mean, as an adult, some people watching this are younger, but most of us remember, the Spanish-American War. If you're old enough to remember 9/11, it's been almost 20 years now. It'll be 20 years in 2001. So it's been a long time.
2021.
Sorry, yes. So it's been a long time. And it's been so long since 9/11 that we forget what the mood was like in the weeks and months after 9/11. In the days after 9/11, I worked at a movie studio at the time, and every car coming into that gate had to be stopped. They had a mirror underneath the car looking for bombs. We thought that any day now, any hour now, more airplanes are going to come in. And for years after 9/11, I mean 3, 4, 5 years after 9/11, I couldn't watch the St. Patrick's Day parade or the Super Bowl halftime or anything without waiting for a big boom. And that stayed with me for a long, long time. And it's hard to remember just how much of that was just on our horizon. We look in the sky, there are no airplanes flying. We think, my God, are we ever going to recover from this? And we certainly did recover from it. And what happened was, in the case of 9/11, what happened was we began to fold terrorism into our threat horizon. And nobody is particularly panicked about going out of the house because of the threat of terrorism. But terrorism is a threat that didn't exist before. There was no terrorism of any size before the first World Trade Center, well, before the Oklahoma City thing. But in any event, it's a relatively new phenomenon in society is terrorism. And in those first days, we were so sure that terrorists were going to strike again that nobody was willing to go to large events and so on. And I expected, as I said, a boom every time I saw one. In the years since then, since these things haven't happened, we have learned how to put terrorism in a box that is appropriate for the threat. My chance of being killed by a terrorist is exceedingly small, largely due to the work our military has done in the last 20 years. Overseas, but it's exceedingly small, but it's existent. And it's one of those calculations that I just make subconsciously. If you drive to work, or if you have ever driven to work, ever in your life, you've done this kind of calculation. You know you have to get to work, and you know that driving a car is statistically more dangerous than sitting on a couch. But you do it anyway, because you have assessed the level of risk, you've associated it with the reward, and then you simply have folded the risk of an automobile accident or fatality into all of the risk assessment that you do on a daily basis. And that's what's going to happen with COVID-19. It's going to be something that is exceedingly scary now because we don't know what size box to put it in. But as time goes on, and I mean short-term time, what's going to happen in the next week or 2 weeks or 3 weeks is we're going to see the number of cases in this country explode. It's going to be mind-boggling how fast they're going to grow. That's a result of the people who were infected starting to develop symptoms. And as those symptoms start to mature in the next week or two, we're going to see the number of deaths that are related to COVID-19 increase, but we're also going to see the number of complete recoveries increase. And the number of people that we know in our social network that recover is going to be 20 or 30 times larger than the number of people we know that don't. It may be 50 or 100 times larger. And when that starts to happen, it's not a question of when the data is released to the public, but when you begin to know, after this infection becomes widespread enough so that it's relatively common, and it's going to happen, it's just going to happen. I knew that the second I heard it was a flu virus. Then people will begin to feel the mortality rate rather than think about it or understand it. They will be reassured to the extent that a number of people that they know that they're close to are healthy, and just basically healthy. They're going to get this and they're going to recover. That's what the statistics say, and that's what all of the data says. And then they might have an aunt or an uncle who's in their 80s or something, who either has had a case of emphysema or heart disease or something like that, and that person may succumb, and then we'll have an emotional gauge on it. But in terms of the emotion now, in terms of today, probably the best advice I could give about the fear is not only to understand what the disease is and where it's going to hit. We know where it's going to hit. It's not like this is a mystery. It's not like we don't know who's going to come down with. It's not like we don't know who's going to be in danger from this virus, because anybody can come down with it. It's a freaking variation of the flu. So what I would simply say now is understand the category that you're in, and it really is basically fundamentally two categories. There's a high-risk category and a low-risk category. If you're a healthy person, you don't have any serious pre-existing conditions. If you're not on, if you're not in partial kidney failure, you don't have emphysema, if you're a healthy person, then the survival rate, this is Johns Hopkins Medical School saying that in China, with all the air pollution and the spitting and the smoking and everything else, of the mild cases, the survival rate was 100%, and of the severe cases, the survival rate was 100%. It's only the critical cases where the deaths came. So find out which one of those boxes you're in, and it turns out that virtually everybody is in the box that doesn't have to worry about their personal survival. And then, once you get that under control, then you can start asking yourself, okay, now what? We want to save as many lives as possible. And saving lives means continuing to have an economy. just in the same way that we want to reduce the number of traffic accidents on the road as much as possible, and we have seatbelts and we have airbags and we have anti-lock brake systems, the highway fatality numbers have just absolutely plummeted. And plus getting drunk driving, largely under control. Number of people that get killed in car accidents has just plummeted, but it's still there. And that's the kind of thing I'm talking about. You cannot stop automobile accidents completely unless you stop driving, and you can't stop driving, and no one is suggesting that you could. And if somebody were to come to you and say, I think that if one life is saved by never driving ever again, this includes buses, no more transportation on the ground, period, other than bicycles. If you were to come to somebody and say, you're never going to drive your car again, you're never going to get on a bus again, ever, but it will save lives from people who would have otherwise died in auto accidents. And if we save just one life, isn't it worth it? It's not. I hate to be the guy who's giving it to you, but it's not, because the cost of not driving is far greater than the cost of driving, in terms of lives, in terms of happiness, in terms of all the things that we value. So yes, I agree. Conservatives can look very hard-edged about this, and part of the hard edge of conservatives is not generated by the disease. It's generated by the panic. It's generated by this sense of, this is absolutely nuts to be this insane about things. So I think, on reflection, that the social isolation is a good idea. I'll tell you one thing, we've never been here before, and here's my final thought on this. I am really beginning to think that when it's all said and done, that the COVID-19 pandemic will have been a vaccination for society, not against COVID-19, but we have never, ever had to deal with a pandemic that actually got out of the cage. Ebola doesn't have anything like the infectiousness that this does, and we were able to keep that in the cage. But we've never had one that got out of the cage. And as you probably know, when you're vaccinated, you're given a weakened form of the disease, or perhaps even a killed form of the disease. You take smallpox, let's say, and you weaken the virus or practically kill it, or kill it even. And you inject it into your body. Your antibodies, your immune system over time recognizes that intruder, makes antibodies to identify it. And the reason that a vaccination works, and we're not all dying of measles like we used to, is because now when the measles virus comes in, with switching from smallpox to measles, now if I get a measles virus inside my skin, my immune system doesn't have to figure out how to fight this thing and spend 2 days figuring it out. Now, second that virus gets in there, the immune system says, okay, I've recognized you, I've been here before with you, and we're going to start fighting now. And when I say that COVID-19 could be a social vaccination, the point I'm trying to make is, we are learning with this virus, we are learning very, very valuable lessons on how to deal with a pandemic, on how prepared or unprepared we were. We're learning a lot of things. And of all the things we're learning, epidemiologists are going to be able to see, for the first time in history, as far as I know, what social isolation does to the spread of a highly contagious disease like a coronavirus. And so with all genuine, honest to God sincerity for the people who are at risk and the people we've lost, and I have some of them, and it's certainly not unlikely that some of them will be a victim of this thing. But with that said, if all of these lessons that we're learning from a disease whose mortality rate likely in developed countries will be well under 1% and confined to elderly and very sick people, we are learning a lot. And what we learn from this may in fact protect us from something much, much, much worse, because we are training our entire society as an immune system on how to fight and how to break the chain of infection on a pandemic. And while again, you always have to qualify this by saying, I understand that lives lost are lives lost. We're talking about a global phenomenon here. Doesn't mean I don't care about individuals. But it is certainly the case that compared to some of the potential pandemics that we could be facing and continue to face, this one is a real weak one. And that's no consolation to the people who are at high risk and who succumb to it. But speaking in terms of society, you could almost look at this as a drill. We had exercises, drills for the Normandy landing, and it turned out that 800 men died during the training exercise for Normandy. They just were practicing coming ashore on a beach, and there was a U-boat out there, sank a couple of transports, and 800 men died practicing for D-Day. So drills are not without their risk, but through the idea of a drill, a fire drill is a way to, when you have a fire drill at a school, you're accomplishing two things. First of all, you're trying to find out where the failures are. Is everybody bunching up at that exit? That's something we got to think about. But the other thing that a fire drill does is it gets you used to it, gets you familiar with the procedure. And when we had fire drills in school all the time, when I was in school, we'd have a fire drill and we just all of a sudden the bell would ring, fire drill, we'd get up and we'd march out the door and we knew what to do. And the reason that we had the fire drill was because when the fire comes, it makes a survival rate for everybody much higher. And I think that this virus is a fire drill, and it's already cost a lot of lives, and it's going to cost a lot more. But compared to how naked we were, I think the world after COVID-19 is folded into our threat assessment. It's just another thing that we get vaccinated against in the future. Then we may find that we have made changes in the world that are of enormous importance in terms of protecting us against this kind of thing happening again with a much, much, much nastier customer.
And through it all, we'll be here bringing common sense to bear on the news of the day, bringing foundational principles of conservatism into the analysis of what our politicians and people are doing around the world. We are able to do this because of folks like the people at the Patriot Post, for example, who have made it possible for you to download a free copy of their Patriots Primer on American Liberty. We know you're going to enjoy that, but even more so, you're going to enjoy your daily visits over at the Patriot Post. We'll provide a link in the description below. And of course, we couldn't do any of this if it weren't for the members at BillWhittle.com, who are carrying on a vigorous discussion in member-exclusive areas of the website, who get members-only content, and who are the producers of 5 episodes of Bill Whittle Now every week and 5 episodes of Right Angle with Stephen Green, Bill Whittle, and myself. You can be one of those producers, and you can find your people in those members-only aspects of the website by going to BillWhittle.com and clicking that Become a Member link.
And we will be here. And we will be here throughout this entire thing. And we'll be talking about the kind of common sense things that people that are drawn to this show need to hear. And not only will we be here throughout this pandemic crisis, but we'll be here on the other side of it too. And it's our decision as to whether or not this becomes a panic. But what I'm seeing is while people are nervous and afraid, the mood is excellent. The people in the restaurants that are open, the people in the drugstores, the people in the grocery stores are cheerful, they're happy, they're kind, there's no elbowing people in the teeth. People are worried and nervous. They've never been through this before, but they're handling it like champs in terms of maintaining their civility, and that is the most important thing. So we're going to be here pretty much every day until this thing has basically stopped becoming an agent that is affecting the regular course of our life. And once that happens, we'll be here after that too.
For Bill Whittle, I'm Scott Ott. Thanks for watching.